I'd like to talk a little bit about today what you want to talk about, but I have a question, and that is that getting people to know more about hospice. Some people have a fear of hospice. Recently, my father, in his very last day of life, it didn't last too long, but in hospice. And maybe explain what you both think. We had a conversation off mic about what people think or maybe don't know about hospice. So who wants to go first? Okay.
Sure, I can.
Anne-Marie McChrystal, founder of VNA. It's great to have you here, by the way, sweetheart.
Thank you very much.
She's lovely as ever and beautiful, and she has deferred over to Michael. Michael?
She has.
What do you want us to know?
Well, thank you for asking, first of all. And you're right. It's a difficult subject to talk about because we're talking about end-of-life issues, which is never an easy conversation to have with family members or with people in the medical community. And that's one of the things that we hope people understand a little bit better after we get done our conversation today is about hospice care and really what the intent is. Because, there are so many myths and misconceptions about hospice, what it is and what it is not. And I think a lot of those misconceptions cause fear in people. And that's one of the reasons I think that folks in our community and across the country really don't take advantage of the great services hospice has to offer.
And they don't want to face, like right now, somebody's listening right now going, well, do I listen to this interview or not? And not thinking that, will they, or even dismissing the fact that they may have to someday face this decision. We don't want to face it. Nobody wants to talk about dying. Everybody wants to go to heaven, but nobody wants to die to get there. Right. And it's important. You were telling a story earlier on about even your own family. Would you mind reiterating that story?
Sure. I mentioned that, I had a family member, an uncle who passed away on hospice care and had hospice care for a little while, probably not as long as he could have. This was, just as I was getting into working here at the VNA. And I had, a few years later, my grandmother had Parkinson's and ultimately ended up on hospice care. And I had to bring the subject up with my family, which isn't an easy thing to do. I lived at a distance. And so I asked the question, has anybody talked about hospice care? Because she had been in and out of the hospital. And we see that here, with VNA patients too. People go in and out of the hospital. And at some point, a conversation hopefully starts about what's the best thing for this person's quality of life. And in my own family, I know they struggled with that for a long time before asking about hospice care.
Shh, so we won't talk about that. We won't talk about that.
But that, to me, that's a great example because, even for a family that's experienced it once, and may be in a position to utilize hospice and benefit from hospice services again, that's really a tough thing. It's a tough thing to talk about for people. And so, even after being exposed to it, a lot of times it's difficult for people to make that decision or ask that question. And that's the biggest thing that we want people to understand is that it's never too early to ask about hospice care and how it might be able to help. The Medicare hospice benefit, to get into kind of the technical things involved, the Medicare hospice benefit really is intended for folks who have some sort of an illness that, if it follows its normal course, limits their life to 6 months or less. Now, the fact of the matter is that once people come on hospice care, they receive extra care and sometimes live longer than that 6 months. So, we've had hospice patients on service for years. And that's something that I think people often don't understand.
Yeah. Oh, for instance, Jody, who was the lady we used to visit at Atlantic Healthcare who was in hospice, then she got Betty. Betty, that's it. Yeah, Betty. She was in and out of hospice care. She was in hospice care, and then she got better and came back. So it's not necessarily... Right. I hate to say the kiss of death to call hospice.
Right. People don't realize that you can be discharged from hospice care. And a lot of times what happens is a patient improves and no longer meets Medicare criteria, right? So their illness is well controlled. They're not declining. And so Medicare has certain rules that our agency follows and when somebody is suitable for hospice care. And if they're not, they can be discharged from that care. A lot of time they're still going to need some supportive care. Maybe they're going to need home health care that Medicare pays for, or private care that that they're going to pay for a caregiver to come into the home and help take care of them. But that's something people don't understand is that it's not the end of the line. It's the beginning. It should be the beginning of a conversation about what someone wants for the end of their life.
Did you want to say something, Anne-Marie?
No, I think that people think that it's giving up. It isn't giving up. It's living every day to the fullest when you go into the hospice program. And unfortunately, people choose it at the very last, and they don't get the full benefit of the hospice program.
Yeah, my regret was that somebody had whispered in my ear, "Oh, no, he's not ready to die, your father," and I was reticent to put him on into hospice, and I may have waited a little too long. And it's the only regret I have. Other than that, we had a great relationship.
Well, there's a lot of benefit to being in hospice. Not only managing your symptoms and assisting you in the whole process and making you comfortable and whatever. But it's also a wonderful program for families.
Let me ask you this. A lot of people think hospice is for people with cancer only. Can you expound on that?
Well, actually, we have a lot of patients that have cardiac disease. They are heart patients, Alzheimer's. Anyone who has received some sort of a diagnosis or prognosis that if their disease will take a natural course within 6 months, they will probably be reaching the end of their life. And so it doesn't matter what the diagnosis is. But cancer, most people think of cancer because everyone thinks of cancer as having a finality to it. But you could be a heart patient. You could, with end-stage heart disease or a pulmonary disease or Alzheimer's. We've had a lot of patients in our hospice house that are Alzheimer's patients, and they spend their last days there with wonderful 24-hour care.
All right, Michael, if somebody wants to find out more about VNA, do you have a website?
We sure do. It's www.vnatc, that's like Visiting Nurse Association Treasure Coast.com, and there's great information there, information for caregivers, information about the different services, home health, hospice, private duty care. And we really invite people to, think of us as a resource. And if they're not sure especially if they're not sure what kind of help they might need for a loved one, and that's generally the folks that are going to call us, or somebody looking for care for mom or dad or for a husband or wife, we invite them to call us and we can help them walk through.
Okay. Do you have a number that folks should call?
We sure do. Here in locally, it's 772-978-5546.
Okay, would you give that number again?
Sure, 772-978-5546.
And the website one more time?
www.vnatc.com.